Hello, welcome to this episode of our podcast. Today we are talking about a common question for children, for baby teeth and babies growing up. And it is the old classic pacifier. I get a lot of mothers that ask me, when do we get rid of the pacifier? Does it cause problems? Does it make their teeth crooked? When should I get them off the pacifier? And I'm going to give you some current recommendations. This is springtime 2015. And I'm going to go through a recent article I read that was interesting that talked about the pros and cons of a pacifier. And I learned something that I did not know. So one of the pros that I find very interesting about a pacifier is it apparently, or it does, decrease the incident of SIDS, which is sudden infant death syndrome. And the reason, which I found fascinating, was they don't sleep as well. Children apparently don't sleep as deeply with a pacifier in their mouth, which I frankly had no idea. And so what that does is it makes children less apt to have SIDS, which is sudden infant death syndrome, which apparently is when they fall so deeply asleep that they stop breathing. And so if a child is not sleeping as deeply, and they have a pacifier in their mouth, they would wake up before they fell into such a deep sleep. So that's kind of interesting. I've never heard that before, but that was information that I felt was important. So another thing, probably the most common reason children like pacifiers is it is a source of comfort for infants. And so that's important for a mother or a father trying to put their child to sleep. They do want to comfort them. So those are the two main pros. So you have a few cons. Well, first, let me digress and tell the recommendation is for children to stop pacifier usage around the age of 2. There was a podcast here with Dr. Charlie Berteau, who's a pediatric dentist, who I have a lot of my parents' children go see him. And he has different opinions as to how they can stop them. There's different ways they can stop the habit. You can watch that podcast if you like. So some of the cons is it can cause some malalignment. And I'm also referring to thumb sucking also. Any kind of non-nutritive sucking is the term. It can cause some alignment issues with the teeth. It can also cause the roof of the child's mouth as they push their thumb on the roof of their mouth. It can cause a deeper groove in the roof of the mouth, which could cause narrowing of the arch and again different alignment issues. So if a child stops using the pacifier before the age of 2 or before the age of 2, most of these problems will self-correct within 6 months, meaning the natural growth of the child will sort of reverse whatever damages were done. Another con, and this is something else I learned with this article, was that if children use pacifiers, the sucking motion, the constant sucking motion can cause the auditory, the ear tubes to be abnormally open. I suppose it's because of the negative pressure from the sucking. It can cause the auditory tubes to be abnormally open, which increases the risk for middle ear infections. So there's something else I did not know. So let's talk about what are some suggested ways of stopping children if you're a mother or a father and you're trying to have your child stop doing it. You can dip the pacifier in vinegar. Seems kind of a little bit old-fashioned to me, but I guess you put it in vinegar, the child tasted it, doesn't like vinegar, and associates the bad taste with a pacifier. Makes sense. One way I have heard a lot of positive reactions from is to slowly cut the pacifier, meaning you cut a few millimeters off the pacifier so the pacifier becomes less and less appealing, because if it becomes a quarter, a half of a pacifier, 2/3 of a pacifier, whatever, as it gets shorter, it becomes less enjoyable for the child. Eventually, of course, you have no pacifier and they don't have it. So here's some other tips that were suggested about pacifiers. Use it only during sleep time if possible. And do not buy a pacifier that does not have vent holes in the shield. So what happens is if a child is to swallow this pacifier, and the shield of it, the base of it, does not have any vent holes, it is much more difficult to remove it from the, I know this is an awful subject, but it's much more difficult or impossible to remove it from the child's throat. What happens is sort of suction cups inside the throat, and you can pull and it's not going to come out. If you have holes in the shield, that does not happen. You don't create that suction cup, and you can pull it back out. So it's really helpful to prevent choking. A cord on there, I've seen a lot of pacifiers that have a string and a cord that comes to their shirt sleeve so that they don't lose it if they drop it. That was not suggested because of choking hazard. Of course, I guess that depends on how long the cord is, but I assume if it's tied to their shirt, it can be any length can possibly choke the child. So what this article recommended is to find one with a ring. So if you're a parent, you have a child, and you have some questions about pacifiers, I hope this podcast helps. Thank you.